Good morning, everybody, and welcome to our virtual town hall. It is just 9 o'clock, so we will give a couple of minutes for some more people to join us. But we do have an hour to spend this morning and quite a bit of information to go over, so we will be starting within a minute or two. Before we get started, just to give a little run of show so everybody knows what to expect. This morning, you will be hearing from Associate Vice President for Administration, Alix Ogden, who will give a presentation, a PowerPoint presentation on kind of what to expect when coming to campus next week. We also have on the call this morning Interim Director of Facilities, David Snow, who I know needs no introduction, as well as our Assistant Director for Emergency Management, who is focusing on the college's COVID response, Dory Boardman. After Alix gives her presentation, we will open it up to questions. Many people over the last few weeks have submitted questions using the form. I encourage everybody to continue to use that form to submit their questions. If you have read CC Daily, you have seen that we have tried to answer as many questions as possible in CC Daily. We will be answering some additional questions this morning. There are some questions that have been submitted that we haven't quite gotten to yet. So in the coming days and weeks, we will be answering even more questions. So if you don't hear your question this morning or haven't seen it in CC Daily, please know that we are working on responses and we'll share those either collectively with the community if they are broad, but if they are very specific, individually back to the person. Just one thing to note. So this morning's presentation really focuses on next week and the week after that. As you know, we're welcoming many more people to our campuses next week, and there's a lot of coordination that goes into that. We won't be looking at what's going to be happening down the road, either for summer session 2 or for the fall. And that's because we're going to be learning a lot over the next couple of days and next couple of weeks. But also, as we have seen, public health guidance has been rapidly changing. And so we don't want to assume what is going to be required of the college and individuals next month or even the month after that or looking to fall. We will continue to have these conversations over the summer and leading into the fall to provide the very latest information and guidance for our employees and our students. And so with that, I think we will turn it over to AVP Ogden, and I am going to share my screen and her presentation. Okay, I hope everybody can see the screen.
Yes, thank you, Amy. Good morning, everyone. Thank you for tuning in this morning for our virtual town hall. I really appreciate everyone's interest and communication to me and others about what's going to be happening next week when we're welcoming many students back to campus. I think I just want to start by thanking the very many people who have been so helpful and supportive of, kind of developing this response and developing this approach. I especially want to thank our essential employees in facilities and police and IT who have been coming to our campuses all along to make sure that they would be ready for us to come back to and supporting our students and our faculty for teaching and learning remotely and for our staff for working remotely. So with that, I really appreciate Amy's name and kind of the reminder that what we're talking about right now is really, we'll call it summer 1 session. And obviously there might be things that happen during summer 1 that are going to make us need to adjust. But for right now, we wanted to be sure that you knew what to expect when you come to campus next week. So why don't we talk about that? So Amy, next slide, please. Right. So one of the first things is what's going to happen when you come to campus. If you've come to campus, you will note that we have had a screening and temperature check all along. We're going to have the process next week, might take a little bit longer. So we just want you to be sure to arrive, you know, before your workday starts, before your first scheduled commitment, so that you have enough time to move through the process, through the kind of additional screening that we will be doing next week and next week only. And I'll talk more about what that is. So we have the screening questions right at the door. They are the ones that you might imagine. It's a kind of a symptom check-in about if you've traveled or been exposed. You can use the CCRI COVID-19 Health Check app, which is just a great way to move more quickly. Thank you, Dory. And what it does is it allows you, just instead of saying no, 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 it just, you answer before you get even to campus. You get a big green check on your phone and you can show it as you walk in. For next week only, we are asking everyone who comes to present either a negative test taken within 72 hours of their first visit back to campus or a record of a vaccination. If someone has not heard this town hall, has not read an email, we will have the ability to test people when they come on campus. You know, we don't want that to be a huge number of people, but we do have that ability, whether it's faculty, staff, or students. Amy, I'm just going to stop for a minute. My screen says sorry. It's okay. Thank you. You can also, if you don't want to take your vaccination record around, you can also just have a photo of the record on your phone and show it when you come in. So if you are one of our faculty or staff who've been on campus working 5 days a week, you're exempt from this requirement. It will be, you will see when you come in, there'll be an option. We kind of have 3 lanes, and that one of the lanes will be you're presenting a negative test, one will be you're presenting a vaccination record, and one will be other. If you fall into that category, you should go into the other lane. And finally, we will be expecting and requiring people to wear masks unless you're alone in your office. When the regulations in Rhode Island relaxed, there was a carve out for agencies and institutions to make individualized decisions based on the needs of that organization or institution. And so we will be requiring masks, you know, for the time. Next slide, please. So a lot of people are curious about what the testing is going to look like. Well, we are participating in surveillance testing that's required by executive order, governor's executive order, which means that we need to test 50% of our population every week. The testing's going to be available on the Knight, Flanagan, and Liston campuses. 50% of our students every week. So we are really strongly encouraging testing for faculty and staff, even if you've been vaccinated. That's actually helpful from a public health perspective, gathering data, and in the case there might be a situation there was a breakthrough infection, meaning that after you're fully vaccinated, you were diagnosed with COVID. So really strongly encouraging faculty and staff to do it. For students who will be required to do it, they'll be assigned a day of the week. And we do have a protocol for following up with those individual students. If they've missed a day, they will be required to come the next day that they're back on campus to go for a test. And the kind of testing that we will be having on campus, it's a self-administered Binax Now test. So it's a nasal swab. It's very quick. Many people probably listening to this call have had them for one reason or another, whether you participated in testing for your own health or had to be screened before a procedure, a medical procedure of some kind. In this case, it's self-administered, and you sit in the testing area for the 15 minutes it takes for your test results to come back. If for some reason they come back positive, there might be a PCR. So that is the more in-depth nasal swab that takes a day or two for the results to come back. Those would be required in two cases. One, an individual tests negative but is symptomatic, and the other, if an individual tests positive and is asymptomatic. So what would happen is that PCR follow-up would be right on site, right in the same testing area, and the individual would be sent home to quarantine pending the results of that test. We can move on. Thank you, Amy. And then what should you expect in the classroom? We are going to be providing cleaning materials. So before and after a work area is used, you'll be able to clean it individually for your use. And there'll be a deep clean of classrooms daily. We are doing this, and as well as having people take responsibility for their own individual work areas outside of the classroom, so that we can have our facilities folks really focus on high traffic areas. So the desks will be spaced at least 3 feet apart. I think some people who are on this call know that the guidance has changed. What we did is we went back to the Department of Health and said, you know, tell us what we should be doing as a higher ed institution. And so, well, they said it should be desks at least 3 feet apart, which we'll do. In a lot of cases, it'll probably be more than that. But that's what you'll find in the classroom for the summer, with a registration of 12 students in each class. We've already identified, of course, the classrooms where they will be, and are right-sizing the number of desks in those classrooms to the number of students who are enrolled. And finally, in classrooms, we will have air filters. We have bought a bunch of them so that we can have one in each classroom. And so they will be there on day one. Great. Thanks, Amy. And finally, there's been a lot of questions about vaccinations, so I just wanted to take a minute and talk about what's the current status. So it's been in the news over the past week that URI has mandated vaccinations for students for fall 2021. At this moment, we are strongly encouraging everyone to go get vaccinated. We know it's the most effective way of preventing infection, and we are fortunate that we have effective, widely available vaccinations in our state. We also are making opportunities to get vaccinated on campus. We had, last month at the end of April, we had 4 vaccination clinics, 1 on each campus. And actually next week, they will be returning so that the people vaccinated and those that will be able to get their second dose of the Moderna vaccine. We are also working closely with the Department of Health to identify additional opportunities on campus, such as our enrollment days. That's been met with enthusiasm from the Department of Health, and we are really hoping to make that available to our enrolling students and their families on those enrollment days. And then finally, in terms of any future requirement about a vaccine, we're in conversations with our sister institution, RIC, and the Office of the Post-Secondary Commissioner about that, and are really carefully looking at what's happening nationally and what's happening kind of here at home and what's happening in our state of Rhode Island. So with that, that ends my presentation. We have a ton of questions that we have, and we're looking forward to answering for you. But that's just supposed to give, kind of a higher level overview about what to expect when you arrive back on campus next week.
Great, thank you, Elise. So why don't we move it right into the questions? And many of you on the call may not know Dory Boardman. So why don't we use this as an opportunity for you, Dory, to introduce yourself, and can you share a little bit more about what your role entails and the type of work you'll be doing here at CCRI, and also if you can just share what are the types of issues or concerns or questions that employees may have. Should they reach out to you, or say maybe reach out to Dave or Alix or perhaps somebody else? So Dory, please.
Good morning, Amy, and thank you very much for this opportunity. I was hired by CCRI as the COVID-19 testing manager, and my responsibility is to ensure the safe return of all persons for in-person learning for the CCRI community. So in that regard, I have designed and implemented the following program. I will discuss the following program and to talk about more about the details of what to expect on your first day back. First, I'd like to say that all of that we have designed is in accordance with the Department of Health and guidance with the Department of Health and the Rhode Island Department of Education and CDC, of course. So as it was said, everybody must attest to the screening questions, which has been provided many times. So many of you have seen these screening questions, and it would be helpful if when you come to campus, if you've done it already and you put it on your phone so that it can be shown as documentation. So I'm going to talk a lot about documentation and what things you should bring with you. And that would be a great thing, though we have something if you don't have the screening questions. And then you will have to have your temperature taken. This is regardless of what your business is here on campus. So if you're just coming, for example, to take a test for driving for our younger CCRI community, you would just go through the testing, and you would, of course, have to wear a mask all the time while on campus. So now I'd like to move to the first week of classes here on Monday, starting on Monday, which I'm very excited about. There will be 3 lanes when you arrive at the 3 campuses, and I'll talk about Newport separately. So for Knight, Flanagan, and Liston, we have 3 lanes. And first I'll talk about if you show up with your proof of vaccination. And to be clear, to be vaccinated, you need to be past 2 weeks past your second dose. So if I came to campus and you show your vaccination card and you've taken the screen, you've done the screening questions, we will present you with a sticker, a special sticker from the vendor that we have called Purple Shield, and that will be placed on an identification. So if you bring your ID with you, or if you don't have anything, we will provide a card so that you will, from then on, be able to show the card or your ID with the sticker, and that will get you through in a faster way moving forward. So you don't have to show your vaccination card every time, is what I'm trying to say. So that's what we're doing, and that'll be 1 lane. And we will also be campus police and others, we will all be there on first day 1. We will be pulling people from the line in order to make sure that we have a constant flow so we don't have backups. We're really concerned about that, and we really want to address that to make sure that we can get you through as fast as possible on your first day. However, we do ask for some patience as we try to implement this program. The second lane is if you have proof of your 72-hour negative test. For that, we are going to provide colored stickers that you will receive in another lane, and on that sticker it will write that it needs to be a valid. You can do that, but that can be with your phone or with a paper copy, and we will write down the date that you got your test done, your negative test, and then you won't have to be tested for another 2 weeks beyond. That's if you're in that lane. Now, that will also help you get through faster if you have that colored sticker on either your ID or a card. And then there's the other lane that AVP Ogden talked about, which is the kind of the catch-all as we're trying to figure out the best way to process everyone to this program at the front door. So this process our doors open at 7 a.m. and we will be processing people all week long through this program through Knight, Flanagan, and Liston. As I said, Newport we're not going to have a testing site at Newport. So we ask that people show, if you have your vaccination card, please bring that. We are going to have someone to process this to the 3 lanes. We'll still have that set up. And then the 72 negative test and the other lane, of course. So we're going to take care of Newport, but not in the same. We would expect to have the test presented, the negative test is presented at entrance. Of course, we will be there. There will be what we will have. My intent is to hire COVID compliance ambassadors. I don't have them yet, but we do have people that will, CCRI staff will be available all next week to answer questions, to be helpful, to guide, to help you through the process. Another important part of my program is going to be contact tracing. So this office will take care of any positive cases, working with the Department of Health and Compliance. We will be the liaison between for the Department of Health. We do have resources that we're talking about implementing and haven't quite gotten it up and running yet. It's a texting service for faculty and staff, and so it's for COVID issues that may happen on campus during campus hours. And if you need assistance, say for some reason that you have run into somebody who refuses to wear a mask, even though you've tried many times and many ways, and they just refuse. And if you need assistance in that regard, we are going to offer a texting service so that you can text the number, and the CCRI COVID response team can then assist you. This will be manned by this office, campus police, and Michael Cunningham, Dean of Students. I can't hear you.
Thanks, Dory. That was really comprehensive.
Okay.
I was muted. Thank you, Dory.
Okay.
If Laura Leaks could clarify, so when an employee comes to campus next week, say for the first time, they will not be required to show their proof of vaccine or a test of 72 hours going forward, right? That is only the first time that they come to campus next week. And then after that, they will not need to show that same proof, but they will still be required to fill out to attest that they have no symptoms or been in no contact with somebody who's been sick, and they will still have to have their temperature screened, correct?
That is correct. For everyone who visits campus, regardless of your business.
Okay, great. And do you have, when will the surveillance testing protocol that you mentioned, do we know when that will be up and running? And to clarify, that is for students will be required to take it, but faculty and staff are encouraged to take it?
That is correct. So that is up and running on Monday for all three campuses, as I spoke of, just not at Newport. So we would request that if you needed to get testing, that you Google COVID testing near me, sites near me, and they're everywhere. If you have any problems at all, please contact my office, 825-2001. I can help with questions on can't get a test, or how do I get a test, or if you have any questions with the information that we're requiring at entry, please give my office a call. We can help with that too.
Yeah, and Amy, if I could just add two quick things. Testing will be available on campus next week, but the actual surveillance testing won't start until the next week because of when enrollment locks for summer one session. And the other thing is, we would encourage people to go to try to find a place for rapid testing. And that is because just the PCR results, if you take a PCR test today, you'll have the results if you're supposed to come into to campus on Monday. But the PCR test can take a couple of days to get your results back.
Great, thank you. Dave, why don't we turn it over to you? We've received a couple of questions. If employees need things like cleaning supplies for their classrooms and their offices, what is the best way to request those? Where do they find them?
All right, so we are making every attempt to have all the classrooms that have been identified starting on Monday fully supplied with spray, disinfectant, wipes, hand sanitizer, towels, whatever they might need to keep desks and student areas clean. They can always email me directly or call the physical plant numbers and just let us know what you're lacking, and we will get it up to you right away. Both the whole physical plant team, whether it's housekeeping or techs, we will do what we need to do to make sure you're fully supplied with various cleaning supplies and disinfecting materials.
Great, thank you. And on that, there has been some concern about restrooms, restroom cleanliness and capacity. Can you explain the protocols and the enhanced cleaning that your team is doing there?
We basically clean restrooms a minimum of 3 times a day, depending on what the schedules are. And again, they get deep cleaned every evening by a contract cleaner. The large public restrooms, we're trying to recommend social distancing, and in some cases, the maximum they'll be able to have at any one time would be 2 people, because of some things we've done to block fixtures in the restrooms. The private restrooms remain basically single use, and we're going to try to make sure that all these restrooms also have necessary disinfecting sprays and cleaners available, so that you can at least leave the restroom, some of the private restrooms, the way you found them. But again, if you have an issue or you discover a problem, let us know as soon as you can, because we'll get on it right away.
Thank you, Dave. I know either Alix or Dory with this question. So we have lifted capacity on elevators. Since last March, I believe the capacity has been 2, and we have lifted that capacity. Can you explain the reasoning and the thinking behind that for people?
Sure, I can take that. So we did limit it to 2 in order to allow for social distancing. We are lifting that limit because being in an elevator with someone for a period of 30 seconds doesn't constitute a close contact under the guidelines. So just to remind everyone what a close contact is considered, it is if you've been within 6 feet of someone for 15 minutes or more over the period of 24 hours. So the determination is that is not, that does not, if you're riding in an elevator with someone, it doesn't rise to the level of being a close contact.
Great, thank you. And I think I would add that to that as, if the elevator door is open and there's several people in there, maybe consider taking the next elevator, and also to just give preference and priority to those with physical limitations, particularly here on the night campus, getting up to the 6th floor. So if you can walk up the stairs, please do so.
Yeah.
Great, thank you. There have been a number of concerns about what to do if a student arrives at a class or an appointment without a mask. And what advice, I know we're establishing this COVID response testing line, but what steps would you suggest that people take before it gets to the point of needing to seek assistance?
Mm-hmm. Well, first, I would suggest that you ask them to put on a mask. And I think that it's perfectly reasonable to say, you can't come into my office until you have a mask on. The rule is that you need to be wearing a mask everywhere indoors on campus. And if that person doesn't have a mask or left their mask somewhere, the next step is to send them to the entry checkpoint. We will have extra masks to distribute to people who either forgot to bring them or who are not wearing them. If the issue is seems to escalate more than that, we do have the texting option that will be available. But of course, you can always call Dory for assistance, and she can either come and help out with the situation, or ask either the Dean of Students or College Police to come to be of assistance, depending on the nature of the circumstance, the nature of the incident.
Great, thank you. And from a marketing perspective, I will say that we have been communicating to all students that masks are required, and we will continue to reinforce that message over the weekend and the beginning. And I will I know Vice President Costigan is not on the call as a panelist today, but particularly I would say for faculty, spend a few minutes in that first class, reminding the students of what the guidelines and the rules are, and model that good behavior so that they're hearing it directly on the first day. That would be very helpful. Marketing has also created signs that are available to download, or if you want any, please just email marketing@ccri.edu, and we can provide those for you so that it's very clear. If you feel more comfortable having a sign at the entrance of your classroom or your office, we can provide those as well.
Amy, you raise a good point about just kind of taking it next week and faculty and students. It is possible that we will have students who come onto campus who will need to get tested, and maybe they cut the time a little bit short, not realizing that we really were going to, if they didn't have proof of a negative test or a vaccination, that we would test them right away. So please just know that some of your students may be delayed on their first day on campus if they end up being required to take a test upon entry.
Thank you.
And may I add that the test itself is quick, but the results take 15 minutes. So that's that.
Now, Ali, in the presentation, you mentioned that people have been coming to campus 5 days a week, do not need to show proof of vaccine or show proof of a negative test within 72 hours. If somebody has been coming to campus and they are fully vaccinated, do they still go through the same, I guess, entrance point and process, or how will that work?
Yes. So if someone has proof of a vaccination, we would want them to come through that line, the line that says vaccination, because we do, if we have the opportunity to kind of have a sense about the population within the college that has been vaccinated, that's helpful information for us for decision making going forward.
Great, thank you.
And if I might add, that initially that will be the case, so everyone will be funneled to the same entrance point, but we do hope to, we will be changing as we learn, and there may be an opportunity to pull the people that we know are fully vaccinated. It's on record. They could come through sort of an easy pass, a faster way to get to campus.
We'll be looking forward to the fast pass for sure. So, Dory, there may be reasons why a person is currently unable to be vaccinated or take a COVID test. And I believe it's if somebody has been diagnosed positive for COVID, they have to wait 90 days before they can take a COVID test. So what should those people do for next week when they come to campus?
They should bring evidence of their positive test with them and go into the other lane. We consider them exempt from testing during the 90 days, but we will need to track it on that first day that they get onto the rotation, the testing rotation as required by Department of Health.
Great, thank you. And we did have a couple of questions. So to be very clear, there have been some people that say have been working 3 or 4 days on campus, but not 5. Are they exempt, or do they have to follow this policy of proof of vaccination or a test?
We would ask them to follow the policy of proof of vaccination or proof of a negative test.
Great, thank you. And just to clarify, to be fully considered, it is a full 14 days from your last dose. So if it's the Johnson & Johnson 1 dose, it'd be 14 days from that. Moderna or Pfizer would be 14 days. Not 13. I know a couple of people I'm just on the cusp, but if it's a 12 or 13, they still have to show that negative test, correct?
Yes, they do. They do. I know that 14 days can seem like a long time when you're waiting for it to come.
Yeah, but I think that is certainly very important. So Elise, I know that you covered the 3 feet social distancing in the classroom. And that's assuming around campus as well. I know there are 6 feet markers in lots of places around the campus from when it was 6 feet. But Dave, can you talk about the work that your team has done to ensure that, and working with enrollment services to ensure that the best of our ability that students comply with the social distancing guidelines once they're in the classrooms, because a lot of those desks do move.
All right, was that, Amy, were you asking me that question?
Yeah, so I know
Okay.
your team has done a lot of work with enrollment services to prepare the classrooms.
Right.
So maybe
Okay, so we have set classrooms right now at, let's call it 5 to 6 feet, and we're targeting for the 12 stations in each classroom. There may be some that we couldn't quite get to 12 that are a little bit less, but we are matching what enrollment services are telling us are the current enrollment numbers for the classes. Lecture halls, for example, can hold a larger amount of students, and those would be appropriately marked. We expect that as the summer sessions move forward, as we get closer to the fall, there might be adjustments to those settings. But right now, we've set for the 12 student, which is roughly 5 to 6 feet.
Great, thank you. I know that's been a lot of hard work. So, Dave, vendors, I see Dave and Dory. So, vendors, not employees and not students, or not somebody maybe coming to our campus for an appointment, but vendors. Can you talk through what vendors are currently doing and what they would be expected to do moving forward?
Okay, so vendors right now follow a screening protocol. They actually have to read a sheet and they have to sign the document, and they do that every day. Or they get screened as a group. Our night cleaning crews are required to be screened every day as a group. We get a sign-in sheet, and we expect that they're following our protocols, masks throughout the facility, and screening every day. They will continue to do the same process that they're doing now. If we have a vendor that's coming in for a repair call, they have to go through screening. They're expected to wear a mask, and we're not going to change that process.
Okay, great. Let me take a peek and see if we've covered most of the questions that, so just to clarify, so the COVID ambassadors and the COVID response text lines, we expect those to be in place next week?
Actually, because of the COVID, for the COVID ambassadors, that needs to go through the hiring process, so I do need a little bit of time. But in the meantime, we do have that role by our vendor and by staff at CCRI who have graciously offered to help out. So there will be plenty of ambassadors to help out and assist during this, especially during the first week. I wanted to also say, if you had any questions with entry requirements, please contact me. My preferred contact would be my email address, dboardman@ccri.edu. I will also have a cell phone, so I fully intend to be in contact with all 4 campuses throughout the week. So if there's any problems that arise, they can quickly come to me to be addressed.
Thank you.
Oh, and the texting, that is still in progress. We need to see about coverage. And I did want to mention that it's not for a true 911 call. This would be just for an on-campus COVID response situation that we could for our assistance, a de-escalation or what have you, whatever it may be. We're hoping that it's a special occasion that it's used, and we're hoping that it was just used Monday through Friday.
Okay, so I'm looking at the questions, and I think that we have covered pretty much all of them. But I want to give each one of you an opportunity. Is there any additional information or clarification that you would like to discuss or talk about? So Elise will.
Yeah, I think if I can kind of wrap us up. I think I just want to, we are really looking forward to seeing everyone back next week, and I hope what you're taking away from this is that the safety of our community is a shared responsibility, and we all have to look out for one another. And it is going to take some patience next week. I'm sure, as we all get used to a new process, and as we get used to returning to work on campus. I think that I know my experience has been that the first day was a little strange, and then it feels really normal and happy to be back. And so I just want to really reinforce the fact that this is something we're all in this together. And we're really open to feedback, and we have a system set up that we think is going to work and take that first step for as everyone comes back next week. So there's going to be more to come for sure, and we really appreciate everyone's ongoing attention. Please read your emails. Please read your emails. Please read CC Daily. Thank you.
Thank you, Alex, very, very much. And thank you for the plug for CC Daily. This is recorded, and we will be sharing both Alix's PowerPoint presentation as well as a recording of today's town hall, and include the link to ask more questions. I will also include the contact information in today's CC Daily for Dory and Dave Snow, should you need to reach out to them for coming dates. So with that, one more final plug. Today is also our commencement. So while I have everybody's attention, I ask that you visit ccri.edu at 12 noon, and our commencement will be launched at that time. And it's a great opportunity to celebrate all of our students and all that they have had to endure and go through to get across that graduation stage in this last year. So thank you to everybody, and have a great day.
Thank you.